Dr. Kris Gast with Fort Smith Radiation Oncology is back with us this morning. This time around, we're talking about the benefits of PSA testing for cancer. Thanks for being here. We are learning so much from your segments, and this time around, we wanted to talk about detecting prostate cancer, a PSA.
Right. That is the standard blood test for detecting prostate cancer. Usually your primary care physician will draw that during their annual blood test. There has been in the last week a new study that came out that was put out by a task force that has caused some stir even in my practice already, that said that the PSA screening was actually more harmful than beneficial. And that's caused a lot of controversy in this last week in terms of trying to figure out where does that actually fall in terms, what are we doing with this?
Well, how big was the study, or who was the panel behind it?
The task force is part of a nonprofit volunteer panel of 16 healthcare professionals that are basically trying to just make Americans healthier. They're from the fields of preventive medicine, primary care, OBGYN, and nursing. There are no oncologists on the panel. And basically what they did was look at epidemiological data. And they gave the PSA testing a grade D, meaning that it appeared that it was more harmful to just standardly screen healthy men between the ages of 50 and 70 and detect cancer than to go ahead and use it and find their cancer at an earlier stage. So that's been very confusing to a lot of my patients. They made no recommendations in terms of once you've been diagnosed with cancer in terms of treatment. There was no recommendations on that. But their recommendation was that we don't use the PSA for screening anymore.
Well, this is obviously one study, so where do we go? And I know you said that this is so early, but in protocol, where do we go from here?
Well, I think their main thrust right now is that we use this information to basically open dialogue between the man and their doctor, to sit and really talk about what does this PSA mean, what is it going to lead to if it comes back elevated, and what are the procedures that are going to have to be done, and then if there is cancer, what are the options. But the task force was looking at the population as a whole, a group of patients, just the population, not each individual patient. And on an individual level, each person still has to make their own decision. And this won't make any changes in terms of reimbursement for Medicare or insurance carriers. It's not like it becomes a new law where you can't have a PSA, but it should open up some dialogue between the patient and their physician.
So really, to take away from this, you really just need to be talking with your doctor. You need to have that open conversation so that you can determine what's best for you, because what's best for me may not be best for the next person.
Exactly, and that's really the way that most of the radiation oncologists and urologists approach prostate cancer. Each individual patient is looked at specifically, because even when we get to the process of a man who has a diagnosis of prostate cancer, we don't just shotgun and treat everyone. I follow a number of men who are on what we call watchful waiting, which means they've had no treatment whatsoever, but we check their PSAs periodically, and just keep an eye on them. So, I mean, there's a lot of different options in terms of now screening versus not screening, and also treatment. But each one has to be individually made for each patient.
Well, let me ask you this. Have we seen the death rate fall because we've been doing PSA testing?
Well, that's the other thing that was somewhat concerning as well. Since we've been using the PSA screening, the death rate from prostate cancer has fallen. And, prostate cancer is our number, 2 cancer. It's our number 2 killer in men for prostate. It's right behind lung cancer in that respect. But 1 in 36 men, or 1 out of 36 men will die of prostate cancer. So, it's not necessarily a cancer you can really fool around with too much. Now, that being said, it's very difficult to determine which of your prostate cancer patients are going to eventually have problems from their prostate cancer. Well, and that's where we get into, that individual, discussion and trying to decide what to do.
Well, there are options, there is treatment, and obviously this study just out, we will be talking about this more. Before I let you go quickly, I wanted to talk about National Cancer Survivors Day.
Yes, this is a worldwide event. This is our 25th year. It's basically just a celebration of life for our cancer survivors, our prostate patients as well. Sorry, I just had to get that in there. The Reynolds Cancer Support House is our sponsor. And they're really going all out this year. They're having it at the Phoenix Expo. It's on Saturday, the June 2nd, from 1 to 4. It's kind of a drop-in type of thing, but there are a couple different things that are happening. At 2 o'clock, I'll be talking.
Which is fabulous. She's like, I don't want to toot my own horn, but fabulous.
At 3 o'clock, there's the survivors recognition, but there's a lot of other activities. There's kids things. I think they're going to be fingerprinting kids and all, and just a lot of games. And for my team at work has put together gifts for each survivor that shows up.
We'll come out so we can all celebrate together a big day. And don't forget, if you have any questions, just email Dr. Gast at bfitzpatrick@fsro.net. They're in Fort Smith. You can also mail in your questions as well. Dr. Kris Gast, thank you for being here. We'll be seeing you very soon.
Thank you.
This is 5 Sunday Morning. We'll be right back.